Hello everyone and welcome back to another episode of our show, where we tackle the most controversial topics in psychology and mental health. Today, we'll be discussing whether therapy or counseling should take the place of medication. So, should therapy replace medication? To answer this question, it helps to understand how therapy and medication work, and when it comes to mental health treatment, it's often best to use both therapy and medication in combination. But here are some cases where therapy may be able to take the place of medication. To better understand this topic, we first have to look at how therapy and medication work. Talk therapy is an umbrella term for many different kinds of treatment that can help people with mental health conditions cope and heal. Some types of therapy focus on changing the way you think, like cognitive behavioral therapy. Other therapies may focus on learning ways to manage your emotions. In certain therapies, you may explore your past to find the origins of your current problems. Most types of therapy involve learning skills that you can use when you re-knot in session to help manage your condition. How does medication work? Psychiatrists prescribe medications that fall into a few different categories. Antidepressants are probably the most commonly prescribed psychiatric medications. They come in several varieties, and all of them change the levels of certain chemicals in your brain called neurotransmitters. Neurotransmitters are like chemical messengers that help carry signals to other parts of the body. Different antidepressants target different neurotransmitters, but all of them help improve your mood. Mood stabilizers are another common type of medication used to treat bipolar disorder. They also affect neurotransmitters in the brain. And anti-anxiety medications work similarly to reduce feelings of anxiety. Both therapy and medication can be very effective at treating mental health conditions. Sometimes they're used together. There are even medications that were developed specifically to enhance the effects of therapy. And it makes sense that these two methods of treatment would sometimes overlap, because the goal of therapy is to help people struggling with mental health issues live healthier and happier lives. And that's exactly what medications for mental health are also designed to do. So, which of these options is better? It depends. The first thing to consider is what your particular diagnosis is. Some diagnoses respond better to medication than others. For example, major depressive disorder is one of the most common mental health conditions that can often be effectively treated with antidepressants. Another condition that often responds well to medication is bipolar disorder. But what about phobias or obsessive-compulsive disorder? These conditions tend to respond better to therapy. Another factor that influences which option is best is the severity of your symptoms. If you're having trouble functioning in daily life, then medication may be a good option for you while you get started in therapy. It can sometimes take time for you to build up the skills you need to cope with your condition. In the meantime, medication can help you stabilize. However, if your symptoms aren't severe, therapy may be enough to help you change the patterns of thinking or behavior that contribute to your mental health condition. A third important consideration is the availability of therapy and medication. Depending on where you live, it can be difficult to find a therapist. Also, insurance may not cover therapy sessions, and there can be long wait times to see a psychiatrist who can prescribe medication. In some places, therapy is simply out of reach for many people. In these situations, medication may be the only option available to you. Fortunately, there are also online therapy platforms that allow you to connect with licensed therapists from the comfort of your own home. Some platforms even offer medication management as part of their services. There's also the question of which option is more cost-effective. Therapy can be expensive, especially if your insurance doesn't cover it. And it can take many months for you to start feeling better. That means you could be spending a lot of money without seeing much of a change. Medication, on the other hand, can be effective fairly quickly, although it may take some trial and error to find the right medication and dosage for you. Unfortunately, medications can be expensive too, so the cost-effectiveness of each option really depends on your unique situation. Finally, there's the issue of side effects. Therapy is a natural option that doesn't involve putting potentially harmful substances into your body. Medication, on the other hand, always carries the risk of side effects. Some medications can cause weight gain, drowsiness, and other unwanted symptoms. Others can interact dangerously with other medications you're taking, and some have the potential to be habit-forming. Even so, most medications have fewer side effects than the placebo pill. Some people experience no side effects at all, and of course, it's possible to stop taking medication once you no longer need it. This isn't true for therapies like electroconvulsive therapy, which some people experience dramatic improvement after just a few sessions. But the effects of psychotherapy can linger for months or even years. The bottom line is that the best option for you will depend on your individual needs and circumstances. There is no one-size-fits-all answer. Let's dive deeper into a few examples. Let's start with medication as the primary option. One reason why someone might choose this route is that they've already tried therapy and it didn't work for them. It's certainly possible that talk therapy won't help you. Maybe the issues you're facing are primarily biological in nature. According to the National Institute of Mental Health, biological factors such as genetics can play a role in many mental disorders. Or maybe you don't feel comfortable opening up to a therapist. Or you don't trust that they'll keep your information confidential. Whatever the reason, you may prefer to try medication first instead of going to therapy. This is perfectly fine. You can always try therapy later if you want to. Another situation where medication may be a better option is if you have a condition that hasn't been effectively treated by therapy alone. If you've tried therapy and it hasn't helped, your doctor may suggest trying medication as an additional treatment option. In this case, therapy and medication work together to improve your overall mental health. You'll likely have to continue taking the medication while you're in therapy, but your doctor may adjust your dosage based on your progress. Another example is if you're unable to afford therapy or can't find a therapist near you, then medication may be the only option left. And finally, medication may be a good option if your symptoms are severe and you need help stabilizing before you can get to therapy. Once you're more stable, you can focus on making changes through therapy. Now, let's talk about therapy as the primary option. The main reason someone would choose to go straight to therapy without medication is that they do think medication is right for them. Maybe you don't want to deal with the hassle of finding a psychiatrist and getting prescriptions filled. Or maybe you've tried medication in the past and had negative experiences with it. Perhaps you gained weight as a side effect or had trouble affording it. Or maybe it simply didn't improve your condition. Whatever your reasons, it's fine to ask for therapy instead of medication. Just be prepared that you might have to advocate for yourself. Some doctors may pressure you to try medication even if you've said you'd rather not. In this case, you may need to seek out a second opinion. If your doctor won't refer you to a therapist, you may need to find one on your own and go self-pay until you can afford insurance. Finally, therapy may be the primary option. If you have a condition that research has shown responds well to therapy, but not necessarily to medication, a great example of this is a phobia. Phobia is an intense, irrational fear of something that poses little or no actual danger. But the fear causes you to avoid the thing you're afraid of, which can negatively impact your life. Exposure therapy is a type of therapy that's proven effective at treating phobias. This approach gradually exposes you to the object or situation that you're afraid of, so you can learn to manage your anxiety. So, if you have a phobia, you may decide to skip medication and go straight to exposure therapy. As you can see, there's no simple answer to the question of whether therapy or medication is better. It all depends on you. Consider the benefits and drawbacks of each option carefully and be honest with your doctor about your preferences. Be prepared to advocate for yourself, especially if your doctor seems biased toward one option over the other. Ultimately, you have to do what's right for you. It's worth noting that some people benefit from a combination of therapy and medication. If you're not sure which option is right for you, ask your doctor if there's a therapist they can recommend. Some doctors work closely with therapists to help their patients make informed decisions about treatment. If you've made it this far, we thank you for watching this video. Please like and share it with anyone you feel will benefit. Until next time, remember to take care of yourself and those around you. We'll see you soon.